Assalamu alaikum everyone. Before starting my topic, I would like to thank Pakistan Cardiac Society, GoRed and AFIC for giving me opportunity to have a talk on this important topic. So today my topic of discussion is high blood pressure may raise future kidney disease risk for pregnant women. The overview topic that I will be covering today includes introduction, types of hypertension seen during pregnancy, mechanism, screening and prevention. So more than 15% of women are affected by some form of pregnancy-related hypertension during their reproductive life, and these women are at high risk of developing chronic kidney disease. In this figure, lowermost black line represents women with no history of preeclampsia, whereas upper blue line represents women with history of preeclampsia. So this figure clearly shows that women with history of preeclampsia are at high risk of developing chronic kidney disease as compared to women with no history of preeclampsia. One study in Norway has shown that if women has history of preeclampsia in one pregnancy, relative risk of developing chronic kidney disease is 4.7. If there is history of preeclampsia in two pregnancies, relative risk of developing chronic kidney disease is 6.4. And if there is history of preeclampsia in greater than two pregnancies, risk reaches up to 15.5. So with recurrent preeclampsia, risk of developing chronic kidney disease further rises. So what are the types of hypertension seen during pregnancy? One is chronic hypertension, means high blood pressure that is present before pregnancy or before 28th week of gestation. Another is preeclampsia, that is new onset hypertension after 20th week of gestation, along with proteinuria of greater than 300 milligram per 24 hours. Then there is severe preeclampsia, meaning high BP of greater than 160 by 100 millimeter of Hg, complicated by thrombocytopenia, impaired liver or kidney function tests, new onset pulmonary edema, new onset cerebral or visual symptoms. And there is another term called as early or late preeclampsia. Early preeclampsia means preeclampsia that occurs before 34th week of gestation. Another form of hypertension is gestational hypertension, meaning high BP of greater than 140 by 90 millimeter of Hg after 20th week of gestation, but with no proteinuria or no other sign or symptoms of preeclampsia. So among these forms of hypertension, relative risk of developing chronic kidney disease is higher with preeclampsia as compared to gestational hypertension. And among preeclamptic women, risk further rises if there is history of severe preeclampsia, recurrent preeclampsia, early preeclampsia, or preeclampsia complicated by small for gestational age babies. Latest study in South Carolina in 2022 has shown that black women with history of pregnancy-related hypertension have higher risk of developing chronic kidney disease as compared to white women, and among these women, risk further rises if there is history of hypertension before pregnancy. Mechanism. In case of preeclampsia, hypoproteus placenta causes release of inflammatory cytokines. It causes oxidative stress. It causes imbalance between angiogenic and anti-angiogenic factors. And one of the most important factors on which most of the studies has been carried out is FMS-like tyrosine kinase 1. Now this factor damages endothelium, resulting in endotheliosis. This factor damages podocytes, resulting in podocyturia. Now podocytes have no regenerative capacity. So once the number of damaged podocytes exceeds 20%, focal glomerulosclerosis sets in. And focal glomerulosclerosis, being irreversible and progressive condition, can result in slow deterioration in renal function. Screening and prevention. Women with history of preeclampsia should be followed at 2, 4, and 6 months interval after delivery. And these women should be screened for hypertension, microalbuminuria or podocyturia. If on follow-up there is no microalbuminuria or podocyturia, then these women are at low risk of developing chronic kidney disease. But if on follow-up there is microalbuminuria or podocyturia, then these women are at long-term risk of developing chronic kidney disease, and these women should be monitored for longer period, but once yearly checkup will be sufficient. If on follow-up there is high blood pressure or proteinuria of greater than 1 gram per day, then these women are at increased risk of developing chronic kidney disease, and these women should be frequently monitored at 2 to 3 months interval with good control of blood pressure. So the relationship between chronic kidney disease and pregnancy-related hypertension is complex, so more research is needed. One study that I would like to mention is PRECEDE trial, PRECEDE stands for Prediction of Chronic Kidney Disease Following Preeclampsia, Diagnosis and Early Care. Aim of this study is to identify the diagnosis of chronic kidney disease in women with history of preeclampsia. This study was started in August 2021, and expected year of completion is in 2036. So, preeclampsia, contrary to popular belief that it ends with delivery of baby or termination of pregnancy, is no longer correct. It is a risk factor not only for chronic kidney disease, but also for stroke, and these women needs to be followed up in order to prevent development of these deadly conditions. With this, I would like to end my presentation. Thank you so much.